Hi, this is Dr. Christy Pramuji Daw, and I am the founder and medical director of LifeSculpt Urology. I just wanted to welcome you and let you know what to expect when you come to the urology office. I know a lot of people think of the urology office and they have a lot of fear and trembling in their heart because you don't know what's going to happen to you down there, and you anticipate that there will likely be some level of embarrassment or discomfort and maybe even some pain involved. So I want to try to alleviate your fears as far as that goes. So first of all, I'm going to tell you what we do in our office, and I think this is fairly typical for most urology offices. First of all, we do ask our patients to fill out all their paperwork, their history, their list of medications and supplements, drug and food allergies, their pertinent medical and surgical history ahead of time so that we can enter as much data as possible into our electronic system to make your appointment and the appointments of everyone else more efficient. So hopefully that is done before you arrive. When you arrive, you can expect that the urologist is going to want a urine specimen. That is very standard for almost every kind of urology appointment that there is. So you may want to plan to go ahead and drink a lot of water or fluids and try to hold your bladder so that when you arrive, you're able to give a specimen. We do, at our front desk, we do have specimen cups. So if you come and you really need to go right away, we're ready for you. Then we're going to bring you back to the room, and my medical assistant will confirm your history, get your pharmacy, make sure we have that on file, and see what your main reason for coming is and what your concerns are, what questions you have, what it has prompted your visit, and so what we need to focus on for the visit. Then they're going to do what's called a bladder scan for me. And this is a bladder ultrasound that measures how much urine is in your bladder. So you just lay down on the table and we put a little jelly on right above the pubic bone and can get a very good measurement of how much urine is in the bladder. Next, we're going to come in and talk to you about your history and see what's going on and get some good notes and ask you very pertinent questions about your urological history, what you're struggling with. We're also going to touch on bowel habits because that is very impactful for how the bladder works. And depending on what you're coming in for, we may want to ask you about how this is impacting you sexually, because we don't want to leave that out of the conversation. That's very important to address. And I know a lot of people are hesitant to bring that up with their doctor. So that's why we go ahead and open the door for that conversation to happen. So if you do have any issues in that regard, we can address them and see how that's impacting your overall health. Next, we're going to step out and let you take off your bottoms for an examination, and we offer a drape to cover you up so you feel more modest and more comfortable. Then we're going to come back in for the examination, and we do a very thorough urogynecologic examination, examining for any back discomfort related to kidney issues, abdominal, any discomfort or masses that we may feel abdominally. Then we're going to look at the vaginal area and first of all, check the pH of the vagina, which will tell us the condition of the vaginal walls, give us an indicator of that, and then examine the vaginal walls. We're going to also look with a half of a speculum, which is a little device that you may be familiar with from the gynecology office, and look at the position of the bladder and the rectum in relation to the vagina. This is really no more than what you would expect from a gynecology office as far as the level of discomfort. We're just kind of looking at things from a slightly different angle to see the position of things. That's very important to how things function. We're also going to do palpation, which is where we're going to use one gloved finger to go in and feel the muscles, feel around the tissues, to see if there is any abnormal mass, abnormal cyst, anything that could be contributing to the issue that you're having. And then finally, we're going to have you squeeze your vaginal muscles around our fingers so we can assess your strength. And that's called Kegel strength. And that's also very helpful to help us decide what treatment plan or what options are available to you. Because sometimes, depending on where the condition of the pelvic muscles are, that could be where we actually start working on. So that is it. So there's nothing going into the bladder typically. Now, there are certain occasions where that may occur, but for the most part, we do not catheterize our patients unless we really need to. Nothing else going in except for just kind of a routine, what you're probably familiar with from a gynecologic exam as far as the level of invasion of the exam. So hopefully that gives you a little bit of comfort before you come to the urologist. I would say that it's very important to do an exam for most patients. If they're just coming in for kidney stones, a pelvic exam isn't really indicated. But for most of our patients, a pelvic exam is definitely indicated, and I think you should be prepared for that mentally before you arrive. And don't worry about grooming yourself or shaving your legs. Patients will come in, they'll say, "Oh, I didn't know you were going to examine me. I didn't shave my legs." I'm like, I don't care. Like doctors, we don't care about that. So really try not to let all that get in your head, okay? And then after the exam, we're going to explain the findings to you. We're going to tell you what our differential diagnosis is, what we think is probably going on, and next steps, which is probably going to be some kind of testing for the most part, maybe some medication samples, maybe referral to physical therapy, some testing because maybe surgery is going to be your best option, and we need to get some further evaluation on that. And then what we do with our patients is we give them a written summary, very short, succinct summary of our findings and the next steps so you can keep track. And we also are really big on giving education. So we give a lot of handouts for you to read at home. So then give yourself a little time to actually process that information. I know sometimes we go from one appointment to the next and the information kind of just goes in one ear and out the other, but we're giving you some really good, powerful tools that can help your health move forward. And then we're going to give you some contact information for one of our medical assistants so you know exactly who you can call if you have follow-up questions or as we're getting you through your journey towards a resolution of your issue that you're dealing with. Okay, I think that's a good overview. Hopefully that wasn't too long, and primarily I hope that you feel much more at peace about coming in. Have a great day. God bless you.